Sir, are you okay?
I?
I feel a little uncomfortable in my chest. Started a nurse ago.
A black nurse lost her job to help an elder, unaware that he was the owner of a. When Elena Brooks, a dedicated ICU nurse, was fired for saving an elderly man's life in the hospital lobby, she thought her nursing career was over. But she had no idea that the man she'd risked everything to help was Howard Kent, the billionaire owner of the entire hospital chain. St. Mary's General Hospital stood like a beacon of hope in downtown Chicago, its gleaming glass facade reflecting the morning sun as streams of patients, visitors, and medical staff flowed through its revolving doors. The marble lobby buzzed with controlled chaos. The soft chime of elevators hushed conversations between worried families, and the steady click of heels across polished floors. Despite its impressive appearance, budget cuts had left the hospital understaffed and overworked, with nurses pulling double shifts and administrators focused more on profit margins than patient care. The tension between compassionate healthcare and corporate efficiency permeated every corridor. Elena Brooks, 34, moved through the ICU with the quiet confidence of someone who had dedicated her life to healing others. As one of the few black nurses in the intensive care unit, she had worked twice as hard to earn the respect of her colleagues and prove her exceptional skills. Her warm brown eyes held both compassion and determination, while her gentle hands had guided countless patients through their darkest hours. Elena had grown up in Chicago's South Side, where her grandmother's stories about being denied medical care due to racism had inspired her to become a nurse. She believed that health care was a fundamental right, not a privilege, and she treated every patient with the same level of care, regardless of their ability to pay or their social status. For 8 years, Elena had been a model employee at St. Mary's, earning commendations for her clinical excellence and patient advocacy. However, recent budget cuts had created an environment where following protocol often took precedence over patient welfare. Elena frequently found herself caught between administrative demands and her moral obligation to provide the best possible care, a tension that would soon reach a breaking point. The hospital's new cost-cutting measures had created a hostile work environment where nurses were forbidden from providing care outside their assigned units without explicit authorization from administration. This policy, designed to prevent overtime costs and liability issues, often meant that patients in non-critical areas had to wait for help, while qualified medical professionals were forced to stand by and watch. Elena had already received 2 written warnings for unauthorized patient interventions, once for helping an elderly woman who had fallen in the cafeteria, and another for assisting with a child's asthma attack in the parking garage. One more violation would result in immediate termination. On a busy Tuesday morning, Elena was rushing through the hospital lobby after working a grueling 16-hour shift when she noticed an elderly man sitting alone on a bench near the information desk. Something about his posture, the way he was clutching his chest and breathing heavily, immediately caught her trained eye. Howard Kent, 78, had come to the hospital for a routine follow-up appointment with his cardiologist, but the stress of recent business decisions and the long walk from the parking garage had triggered chest pains that were becoming increasingly severe. Dressed in a simple gray suit and wearing worn leather shoes, Howard looked like any other elderly patient, giving no indication that he was the billionaire philanthropist who owned not just St. Mary's, but a chain of 12 hospitals across the Midwest. Elena approached cautiously, knowing that engaging with a patient outside her assigned unit could cost her job. "Sir, are you feeling all right?" she asked gently, her nursing instincts overriding her fear of administrative consequences. Howard looked up with eyes clouded by pain. I'm having some chest discomfort. It started about 10 minutes ago." Elena's training immediately kicked in as she recognized the classic signs of a cardiac event. She faced a critical decision: follow hospital protocol and call for authorized personnel or risk her career to provide immediate care. Elena quickly assessed Howard's condition, noting his pale complexion, labored breathing, and the way he was pressing his hand against his chest. Her years of ICU experience told her this was likely a heart attack, and every second counted. "Sir, I'm Elena, and I'm a nurse here. I need you to stay calm while I help you," she said, pulling out her phone to call 911 while simultaneously checking his pulse. His heart rate was irregular and rapid, confirming her suspicions. The hospital lobby was crowded with visitors and staff, but Elena noticed that the nearest information desk was unmanned and security was dealing with a disturbance near the main entrance. She realized that if she waited for proper authorization through hospital channels, Howard could suffer irreversible damage or death. "I need you to chew this," Elena said, pulling an aspirin from her personal first aid kit that she always carried. "It will help thin your blood and reduce the damage to your heart." As she helped Howard take the aspirin, Elena was acutely aware that she was violating multiple hospital policies. She was providing medication without a doctor's order, treating a patient outside her unit, and potentially exposing the hospital to liability. But her oath as a nurse was clear. First, do no harm. Elena guided Howard to lie down on the lobby bench, elevating his legs to improve blood flow, while she continued to monitor his vital signs using techniques she had learned during her years in the ICU. She spoke to him in calm, reassuring tones, explaining each step of her care to keep him conscious and alert. "What's your name, sir?" Elena asked, both to assess his mental status and to keep him engaged. Howard Kent," he replied weakly. The name didn't register with Elena, who was focused entirely on his medical condition. She continued her assessment, noting that his color was improving slightly since taking the aspirin, but his breathing remained labored. When the paramedics arrived, Elena provided a comprehensive report of Howard's condition, the interventions she had performed, and her observations about his symptoms. The EMTs were impressed by her thorough assessment and professional handling of the emergency. "You probably saved his life," one paramedic told Elena as they prepared to transport Howard to the emergency department. "That aspirin and your quick thinking made all the difference." As the ambulance pulled away, Elena felt a mixture of relief and dread, knowing that her actions, while medically sound, had violated hospital policy in full view of security cameras and witnesses. Within 2 hours of Howard's transport to the emergency department, Elena was called to the office of Chief Nursing Officer Margaret Walsh, a stern administrator who had been implementing the hospital's cost-cutting measures with ruthless efficiency. The meeting was brief and decisive. "Ms. Brooks' security footage shows that you provided unauthorized medical treatment to a patient in the lobby this morning," Walsh said, her voice cold and professional. This is your third violation of hospital policy regarding unauthorized patient interventions. Elena tried to explain the circumstances. Mrs. Walsh, the man was having a heart attack. I couldn't just stand by and watch him die while waiting for authorization. The protocol exists for legal and financial protection, Walsh replied. You expose this hospital to significant liability by providing care without proper supervision or documentation. Your employment is terminated effective immediately. Elena felt the words hit her like a physical blow. 8 years of dedicated service, countless lives saved, and an exemplary record meant nothing in the face of bureaucratic policy. She was escorted from the building within an hour, her nursing career at St. Mary's ending not because of incompetence or negligence, but because she had chosen to save a life. As Elena drove home, she wondered if she had made the right choice, knowing that her actions had cost her not just a job, but potentially her entire career in nursing. Word of Elena's termination spread quickly through the hospital's nursing staff, creating an undercurrent of anger and frustration among healthcare workers who had long felt caught between their professional obligations and administrative demands. Many nurses had faced similar situations where policy prevented them from providing care. But Elena's firing for saving a life seemed to cross a line that even the most policy-conscious staff found unacceptable. Dr. Sarah Martinez, an emergency physician who had worked with Elena for 5 years, was particularly outraged. Elena Brooks is one of the finest nurses I've ever worked with, she told colleagues. Firing her for saving someone's life is not just wrong. It's a betrayal of everything we're supposed to stand for as healthcare professionals. The story began to circulate on social media with "Hada Justice for Elena" trending locally as nurses and healthcare advocates shared their own experiences with policies that prioritized bureaucracy over patient care. Local news stations picked up the story, framing it as an example of how corporate healthcare had lost sight of its fundamental mission. Meanwhile, Howard Kent was recovering in the cardiac care unit, unaware of the controversy surrounding his rescue. His doctors confirmed that Elena's quick thinking and intervention had indeed saved his life, preventing what could have been a massive heart attack. 3 days after Elena's termination, Howard Kent was discharged from the hospital with a clean bill of health and a new appreciation for the fragility of life. As he prepared to leave, he asked his nurse about the woman who had helped him in the lobby, wanting to thank her personally for her quick thinking and compassionate care. "I'm sorry, Mr. Kent, but Elena Brooks is no longer employed here," the nurse said carefully, unwilling to elaborate on the circumstances of Elena's departure. Confused and concerned, Howard made inquiries through the hospital administration, eventually learning the full story of Elena's termination. When he discovered that the nurse who had saved his life had been fired for her actions, Howard was both shocked and furious. "Let me understand this correctly," Howard said to Chief Administrator Robert Chen during an emergency meeting. "You fired the nurse who saved my life because she violated a policy that would have let me die in your lobby." Chen, unaware of Howard's true identity as the hospital's owner, attempted to defend the decision. "Mr. Kent, while we appreciate Ms. Brooks' intentions, we have policies in place for legal and liability reasons. We cannot allow staff to provide unauthorized care." Howard's response would change everything. "Mr. Chen, I think it's time you knew exactly who you're talking to." The revelation of Howard Kent's identity sent shock waves through St. Mary's administration. As the billionaire philanthropist who owned the entire hospital chain, Howard had the power to implement immediate changes, but he also faced the challenge of reforming a system that had prioritized profit over patient care. Howard spent the next week conducting a comprehensive review of hospital policies, interviewing staff members, and examining the corporate culture that had led to Elena's termination. What he discovered was a healthcare system that had lost its way, where fear of liability and focus on cost-cutting had created an environment hostile to the very compassion that should define medical care. We've created a system where good nurses are afraid to be nurses, Howard told his board of directors during an emergency meeting. Where saving a life can cost someone their career, this ends now. Howard knew that simply reinstating Elena wouldn't be enough. The entire culture of the hospital needed to change, and he was prepared to use his resources and influence to ensure that St. Mary's became a model for compassionate health care rather than corporate efficiency. The challenge would be implementing these changes while maintaining the hospital's financial stability and ensuring that the reforms would outlast his own involvement. Howard's decision to reform the hospital's policies faced immediate resistance from the board of directors and senior administrators who had implemented the cost-cutting measures. During a heated board meeting, several members threatened to resign if Howard proceeded with what they called financially irresponsible changes that would expose the hospital to increased liability and operational costs. "Howard, we understand your gratitude to Ms. Brooks," said board member Victoria Hartwell, a healthcare attorney who had helped draft the controversial policies. "But you're letting emotion cloud your business judgment. These policies exist because they work. They've saved us millions in liability costs and prevented dozens of potential lawsuits." The crisis deepened when Chief Nursing Officer Margaret Walsh, feeling her authority threatened by Howard's proposed changes, leaked the story to healthcare industry publications, framing Howard's reforms as the impulsive decisions of an elderly man who had suffered a medical scare. The articles suggested that Howard was no longer competent to make major decisions about hospital operations. "Billionaire hospital owner's health scare leads to reckless policy changes," read one headline, while another questioned whether Howard's emotional decision-making was putting the entire hospital chain at risk. The negative publicity created pressure from investors and insurance companies who threatened to withdraw their support if Howard proceeded with his plans. The very people who should have been supporting compassionate healthcare were instead fighting to maintain a system that prioritized profit over patients. The turning point came when Howard decided to go public with his story, calling a press conference to explain not just what had happened to him, but what was happening throughout the healthcare system. Standing before a room full of reporters with Elena by his side, Howard delivered a speech that would be remembered as a defining moment in healthcare reform. "3 days ago, I nearly died in the lobby of my own hospital." Howard began, his voice steady but emotional. "I was saved by a nurse named Elena Brooks, who risked her career to provide the care that hospital policy said she wasn't authorized to give. For saving my life, she was fired." Howard paused, letting the weight of his words sink in before continuing. "This is what our healthcare system has become. A place where good people are punished for doing good work, where policies designed to protect profits have made it dangerous to show compassion. The room was silent as Howard detailed the systemic problems he had discovered during his review of hospital operations. He spoke about nurses afraid to help patients, doctors pressured to discharge people before they were ready, and administrators who measured success by cost savings rather than lives saved. Elena Brooks represents everything that's right about healthcare, Howard said, turning to acknowledge the nurse standing beside him. She saw someone in need and acted despite knowing it could cost her everything. That's not just good nursing, that's heroism. The press conference marked a public commitment to reform that Howard couldn't retreat from even in the face of board opposition and industry criticism. By making Elena's story public, he had transformed a personal debt of gratitude into a movement for systemic change. The public response to Howard's press conference was overwhelmingly positive, with healthcare workers across the country sharing their own stories of being caught between compassionate care and corporate policy. The Oz Justice for Elena hashtag evolved into a broader movement calling for healthcare reform, with nurses, doctors, and patients demanding changes to policies that prioritized bureaucracy over healing. Major medical organizations began endorsing Howard's proposed reforms, while nursing schools used Elena's story as a case study in ethical decision-making. The pressure from healthcare professionals and the public forced the hospital board to reconsider their opposition to Howard's changes. The entire healthcare industry is watching what we do next, Howard told the board during their next meeting. We can either lead this reform movement or be dragged along by it, but change is coming whether we like it or not. The board's resistance began to crumble as they realized that opposing popular reforms could damage not just St. Mary's reputation, but the entire hospital chains standing in the healthcare community. More importantly, several board members who were healthcare professionals themselves began to speak up in support of Howard's vision. Elena's reinstatement was just the beginning of a comprehensive overhaul that would transform St. Mary's from a profit-focused corporation into a model of compassionate healthcare. Howard worked closely with Elena to develop a comprehensive reform package that would address the systemic issues that had led to her termination while ensuring the hospital's continued financial viability. Elena's insights as a frontline healthcare worker proved invaluable in identifying policies that hindered patient care without providing meaningful protection against liability. We need to create an environment where nurses and doctors can use their professional judgment without fear of retribution, Elena explained during one of their planning sessions. Good healthcare requires trust between administration and staff, and that trust has been broken by policies that assume the worst about healthcare workers. The reform package included new protocols for emergency situations, expanded authority for nurses to provide care across hospital units, and a patient advocacy program that would ensure compassionate care remained the hospital's top priority. Most importantly, it established a Good Samaritan policy that would protect staff members who provided emergency care outside their assigned areas. Howard also announced the creation of the Elena Brooks Center for Compassionate Care, a new wing of the hospital dedicated to training healthcare workers in patient-centered care and developing policies that balanced legal protection with medical ethics. Despite the overwhelming support for the reforms, Elena struggled with the attention and responsibility that came with her new role as Director of Compassionate Care Initiatives. The position Howard had created for her was unprecedented, and she worried about whether she was qualified to lead such significant changes. "I'm just a nurse," Elena confided to Howard during a quiet moment before the official announcement of the reforms. "I never wanted to be the face of a movement. I just wanted to take care of patients." Howard smiled, recognizing the humility that had made Elena such an exceptional nurse. "That's exactly why you're the right person for this job. You understand that healthcare is about people, not policies. You've never lost sight of why we're here." Elena's doubts reflected the magnitude of the changes they were implementing, but also her deep commitment to ensuring that the reforms would genuinely improve patient care rather than simply generating positive publicity. The official launch of the compassionate care reforms took place 6 months after Elena's termination, with healthcare leaders, media representatives, and patient advocacy groups gathering at St. Mary's to witness what many hoped would be a new model for American healthcare. The pressure was intense, as the success or failure of the reforms would influence healthcare policy discussions across the country. Critics argued that the changes would lead to increased costs and liability issues, while supporters believed they represented a return to healthcare's fundamental mission of healing and compassion. Elena, now wearing the white coat of her new position as Director of Compassionate Care Initiatives, felt the weight of expectation as she prepared to address the assembled crowd. The woman who had been fired for saving a life was now responsible for ensuring that no other healthcare worker would face the same choice between compassion and job security. The implementation of the reforms faced immediate challenges as staff members struggled to adapt to new protocols, and administrators worked to balance compassionate care with operational efficiency. Some nurses, conditioned by years of restrictive policies, were hesitant to exercise their expanded authority, while others worried that the changes might be temporary. Change is always difficult, Elena acknowledged during a staff meeting in the first week of implementation. "We're asking you to trust that doing the right thing for patients will be supported by administration, and I understand that trust has to be earned." The most significant challenge came from insurance companies and legal advisors who warned that the new policies could increase the hospital's exposure to malpractice claims. However, early data suggested that patient satisfaction scores were improving dramatically, and the number of complaints about inadequate care had dropped significantly. Elena worked tirelessly to address concerns and fine-tune the policies based on feedback from frontline staff. The true test of the reforms came 3 months after implementation, when a similar situation to Elena's original dilemma occurred. A respiratory therapist named Marcus Johnson encountered a patient experiencing breathing difficulties in the hospital parking garage, and under the new policies, was able to provide immediate care without fear of termination. The patient, a 45-year-old construction worker named David Rodriguez, had been visiting his wife in the maternity ward when he suffered a severe asthma attack triggered by stress and exertion. Under the old policies, Marcus would have been required to call for authorized personnel and wait for approval before providing care. Instead, he was able to administer emergency treatment that prevented a potentially fatal respiratory crisis. The difference was night and day, Marcus later told Elena. "I knew I could help this man without worrying about losing my job. I could focus entirely on providing care instead of calculating the risks to my career." The incident became a powerful validation of the reforms, demonstrating that empowering healthcare workers to use their professional judgment led to better patient outcomes. More importantly, it showed that the cultural change Howard and Elena had envisioned was taking root throughout the hospital. The climax of the reform effort came when St. Mary's was designated as a Center of Excellence for Compassionate Care by the American Hospital Association, recognizing the institution as a national model for patient-centered healthcare. The designation brought not just prestige, but also federal funding for research into compassionate care practices and the development of training programs for other hospitals. During the award ceremony, Elena stood beside Howard as they accepted recognition for transforming a hospital culture that had prioritized policies over patients. The moment represented more than personal vindication. It was proof that healthcare could be both compassionate and financially sustainable. This award belongs to every nurse, doctor, and healthcare worker who chooses compassion over convenience, Elena said in her acceptance speech. It belongs to every patient who deserves to be treated with dignity and care regardless of their ability to pay or their social status. The victory was complete when Elena announced that 5 other hospitals in Howard's chain had requested to implement similar reforms, creating a network of compassionate care that would influence healthcare practices across the region. The success of the compassionate care reforms at St. Mary's led to immediate changes throughout Howard's hospital chain and inspired similar initiatives at healthcare facilities across the country. Within 1 year, patient satisfaction scores at St. Mary's had increased by 40%, while staff turnover rates dropped to the lowest levels in the hospital's history. Elena's story became a case study in nursing schools and healthcare administration programs, illustrating the importance of supporting frontline healthcare workers and maintaining the human element in medical care. The Elena Brooks Center for Compassionate Care became a destination for healthcare professionals seeking training in patient-centered practices. Most significantly, the reforms demonstrated that compassionate care and financial sustainability were not mutually exclusive. St. Mary's saw decreased liability costs as improved patient relationships led to fewer malpractice claims, while increased patient satisfaction drove higher occupancy rates and positive community reputation. The hospital's success attracted top medical talent who wanted to work in an environment that valued both clinical excellence and compassionate care, creating a positive cycle of improvement that benefited both staff and patients. 5 years after Elena's termination and subsequent reinstatement, the compassionate care model had been adopted by over 200 hospitals nationwide, fundamentally changing how healthcare institutions approach the balance between policy and patient care. Elena had become a nationally recognized advocate for healthcare reform, speaking at conferences and consulting with hospitals seeking to implement similar changes. The Elena Brooks Foundation, established with Howard's support, provided scholarships for nursing students from underserved communities and funded research into compassionate care practices. The foundation's work helped address healthcare disparities by ensuring that diverse voices were represented in the nursing profession. Howard's decision to prioritize compassion over profit had proven that doing the right thing could also be good business, inspiring other healthcare executives to reconsider their own institutional priorities. The reforms had created a new standard for healthcare excellence that measured success not just in financial terms, but in lives saved and dignity preserved. On the 5th anniversary of her termination, Elena stood in the lobby of St. Mary's Hospital, now renamed the Elena Brooks Memorial Lobby, in honor of her grandmother, who had inspired her nursing career. The same bench where Howard had experienced his heart attack now bore a plaque reading, "In healthcare, compassion is not a luxury. It is a necessity." As she watched nurses, doctors, and staff moving through the lobby with confidence and purpose, Elena reflected on how a single moment of choosing compassion over policy had transformed not just her own life, but the lives of countless patients and healthcare workers. Sometimes, Elena thought, watching a young nurse help an elderly patient to a chair, the most important thing you can do is simply care. True healing begins not with medicine or technology, but with the simple act of one human being choosing to help another, regardless of the cost.